For healthcare organizations, for the functioning of the financial aspects of the organization, it's important to be able to understand what your cash outflows need to be. And so the finance leaders, they want to have good projections of what your expenditures are going to be. They don't want you to be too high or too low because it can affect all of their forecasting, which can have downstream effects on even things like bond ratings and the ability to pay bills. So that's why it's important to coordinate with those team members to make sure everyone's on the same page. And that's one of the reasons why we do this research every year. Manufacturers have even focused on changing drugs that are typically or initially given through intravenous infusion to creating subcutaneous formulations that can be sometimes self-administered by the patient. Some of these subcutaneous formulations that require healthcare provider administration, a lot of them are better tolerated from a side effect standpoint. So it just makes it a little bit more suitable to be given in the home setting. And that has been sort of a long-term focus of the pharmaceutical industry is to increase accessibility of the drugs to patients. And by making it self-administered or administered in the home, it does lower healthcare costs and it also increases accessibility for patients that don't live close to a place where they can receive infusions. Kind of like a democratization of healthcare where they call it theranostics, where you are able to do the diagnosis yourself and then give yourself the therapeutic agent. Been one of the great openings for pharmacists is that pharmacists are the most accessible healthcare professional. If you think about the location of especially retail pharmacies in every community. And so if you can diagnose something in the pharmacy and then pair it up with the appropriate therapy, it just improves the time to treatment, improves accessibility, makes it a lot easier for the patients. And then it also reduces administrative burdens on other healthcare providers. So freeing up a lot of resources and time. The pandemic really advanced things as well, right? Because we wanted to keep people out of healthcare facilities and we needed to treat masses of people. And that's been a big public health advancement in the last 20 years is giving pharmacists increased ability to give things like vaccines and other therapeutics, relaxing some of those prescribing laws. And when you have the ability to diagnose, that really makes it a lot easier. I think another thing that's going to accelerate that is AI applications that can help with diagnostics. I could see that as a future step that could further increase that ability to give patients therapy in a setting that's closer to them. And maybe as a companion to a pharmacist,